Joint replacement simply means to resurface or reconstruct the damaged joint. If someone's had an injury to their joint and has a deformity, say for instance of the knee, the end of the knee is damaged, so instead of having a nice glistening white piece of articular cartilage gliding upon itself, you have a damaged area of bare bone rubbing against bare bone. And so what we try and do is resurface that, so instead of bare bone against bare bone, it's metal against plastic. In a knee replacement, we actually cover or resurface the end of your leg bone or your tibia. We use a space-age plastic polyethylene liner on top of the tibial component. We would then resurface the femur with a metal component designed to fit the exact size of the individual. And then you put this together so you have metal rubbing against plastic instead of bare bone rubbing against bare bone. This is what a knee replacement would be. Patients ask me all the time, "Doctor, when will I know I need a joint replacement?" As the surgeon, we can tell you if you're a candidate for the joint replacement. Have you had the proper preoperative evaluation? Do your x-rays confirm the diagnosis of arthritis? Have you had proper non-operative treatment? When all those things fail and you find that it really affects the quality of your life, that you can't do the things you want to do, you can't participate the way you want to with your social activities, your occupational activities, recreational activities, when it truly affects the quality of your life, that's the time to consider joint replacement. And that's a decision that's really made by the patient rather than the doctor. The doctor can tell you you're a candidate for joint replacement, but it's only you, the patient, that has the final say as to when you think it's time. There are many different things that can go wrong with a joint replacement. Fortunately, we know what those things are. We take great precautions that they rarely occur. One of our major concerns is infection. That's why all of our operations on joint replacements at Bryn Mawr Hospital are done in these sterile, clean air rooms like we're in right now. The surgical team, including the surgeon, the scrub nurses, as well as the assistants, all wear special spacesuits with special body exhausts so we're not breathing on your wound at the time of the operation. We give our patients antibiotics before, during, and after the operation to minimize the risk of infection. We have you scrub with a special soap the night before to make sure there's no bacteria on your skin in the area of the incision that could possibly lead to infections. How soon will you be up and around? Well, we try and get you out of bed the next day, get you to stand and put some weight on it. Usually you start out on a walker, and then we progress to a cane or no assisted device as soon as you feel comfortable enough to do so. Our patients are able to return to fairly normal activities after either hip or knee replacement. After knee replacement, I allow my patients to walk, to bike ride, to swim, to horseback ride, to play golf, to play tennis. If you've skied before, I'll allow you to ski. It isn't so much the skiing that's a problem, it's the falling. So if you have someone who's been a skier and knows how to ski and feels comfortable, I have no problem with allowing them to get back to more normal athletic activities. After all, that's one of the reasons we have joint replacements, to try and return those activities that bring joy to your life. We're very proud of our joint replacement here at Bryn Mawr Hospital. We've been doing joint replacements since the 60s. It's just gradually evolved to be a very strong part of our hospital development. We have dedicated staff in the orthopedic department, including physical therapists, social workers, nurses, pharmacists, operating room personnel. We have a special orthopedic floor that does nothing but joint replacements. And we find it's important that if you have a team that's seen every possible complication, seen every possible device that's come down the road, we're much better equipped to handle your particular problem and get you through this safely and efficiently.